We have our 8 main sites on now, so I think we'll get started. For those of you who don't know me, my name is Louise Jones, and I'm going to act as, I don't know what Jeanette are calling me, but we're going to call me an interviewer for today. I really want to thank you for taking the time to join us for this teleconference today. During the fall, I'd say to the Emergency Operations Center, which you'll hear a little bit about today, that oversaw the daily pandemic, that Eastern Health would get a gold star when we reach 200,000 people in the region being vaccinated. Well, we are about to reach that significant milestone. We have more than 198,000 people as of last week, and we're continuing to vaccinate. Newfoundland is well aware of the rest, well ahead of the rest of the country with respect to immunizing its population and protecting it against future waves of H1N1. If you have not had a chance to look at the posters that are placed throughout the region today, please have a look at them. You'll see some equally impressive numbers. We had 46 clinic sites. We had 122 schools that we went in to immunize, and where we immunized thousands of school-age children. We actually admitted 567 patients with influenza-like illness, and of that, 198 actually were positive for H1N1. And our critical care teams took care of 80 patients, and despite our best efforts, some patients did die in this province as a result of H1N1. Our 1877 number took over 15,000 calls from a concerned and often confused public, and more than 2,000 people in this region were assessed through our flu assessment clinics. And to help us do all that, we hired an additional 137 staff to help us out with the pandemic, and many of those staff who came back to work with us were actually retirees who on very short notice came back to help out their colleagues. These numbers might be impressive, but the pandemic experience for Eastern Health was not about numbers at all. It was about people. It was about how we all pulled together, did what we had to do to get a job done. From the staff who provided care to the public to hours of backroom preparation, to our community partners who stepped up to the plate for us. We all came together in an unprecedented way to do a job during a time of uncertainty. Although H1N1 provided our people and our communities with significant challenges, it's important for us to acknowledge our accomplishments and applaud the spirit of cooperation and teamwork that swept throughout the organization during this time. Today we will share some of these stories, and yes, I can truly say that these are just a few examples of our many gold star performances. News of the potential pandemic came to us first in April, and our medical officer of health, Dr. David Allison, was probably the first to hear about the potential pandemic. David is here with me today, and David, can you tell us your initial reaction last spring when you heard that a pandemic might be coming?
Well, my initial reaction, I suppose, was, well, yes, I think we're ready, but we had very little information at the time. I remember actually the town, in fact, at a meeting, and the province started calling around looking for people to organize, and nobody really knew how serious this was. We really hadn't had a lot of information out of Mexico where this seemed to be starting. And we weren't sure whether this was the real pandemic or whether this was just a blip in something else going on.
So what role did you play as we worked our way through this?
Well, in fact, my role was as the incident command leader for public health. And that actually wasn't as we went along. In fact, we decided, I think as soon as we had realized that this was going to involve, this looked like influenza and it looked like pandemic influenza, even though it hadn't been called, we pulled together the incident command team. And that, I think, was a really important step. What we did was we looked back at our plan that we'd written and put on the shelf and said, well, we'll pull this out when the time comes. And we looked at it and we said, this is exactly what we have to do. We have to put together an incident command team so that people know what job is what and what they're going to do, even right now at the beginning, because we were already starting to stumble across each other.
This is maybe the first time any of us have been through a pandemic. What will you take away from the experience of this last 9 months or so?
Well, I think there's a couple of really important messages. I think the understanding of, I think first of all, the incident command structure and knowing how you fit in to that structure and who you need to connect with is one of the most important things. And I think that our experience here is going to carry us a long way, because we have the same kinds of issues on a much smaller scale quite often. And I think now, with all this experience dealing across departments, across the region, across facilities, we've got connections that we know where they fit, we know what jobs people do, and we'll be able to respond better. I think the other thing that I think we very quickly recognized was the importance of having a spokesperson for the system, and I guess that was my role.
And I was going to bring that up if you didn't bring it up, David.
I think it really helped to have a focal point for the media to contact, for people to look to for questions, and to guide the process forward. So we didn't have all kinds of people stumbling across each other again to adding confusion to the whole mix of activity.
Okay. And I would say a special thank you for that role that you did take in the public and getting the messages out, because I think that went a long way with the public and the reassurance and ensuring that they were consistent messages. So thank you, David. Whenever there's a public health crisis, there are many people who work directly, whose work is directly impacted. And today we have Donna Ronayne in Clarenville and Lynn Mercer in Carbonear, who will tell us what they were actually up to during this time of pandemic. Lynn, are you there?
Yes, I am.
So what goes into the kind of planning and preparation that infection control has to do to get ready for a pandemic?
Well, to say the least, we were quite involved. We had to look at developing educational materials so that we could educate our staff. We developed a presentation, and here in rural Avalon, we delivered it about 27 sessions. We developed an H1N1 binder, and to be placed on all units and departments for all staff as a resource for them, where they could look up things. We identified PPE, which is personal protective equipment, what we were going to use, and proceeded to educate staff in how to apply it and remove it. We assessed the need for isolation carts and pandemic supplies. We had to develop a list of supplies which we felt were to be stocked on all the isolation carts that the staff would need, how to make these materials available to the staff at all times, and how we were going to restock. We were involved in planning and setting up of flu clinics, where they would be located, who would staff the clinics, what supplies we would need, what drugs and procedures would be available and carried out there in those clinics. We had many pandemic meetings with our administration looking at the anticipated effect of the pandemic with regard to staff utilization and bed utilization. And this led to the development of a business continuity plan. We didn't actually develop the plan ourselves, but we did take part in reviewing it and assisting with it. And again, we were anticipating high rates of staff illness as well as high rates of patient and bed occupancy. As for the infection control group, we had to identify what information we needed to collect, establish a way for collecting the information for our administration and the government. We developed the flu surveillance form, a database for entering our information. We established ILI or influenza type criteria that we needed to collect, and this all had to be reported. We assisted with developing guidelines and recommendations for documents, and again assisted the government, especially with the emergency response teams and paramedics in the community.